Being rejected by my mother because I love women is one of the toughest things I've ever gone through.
They say I'm not his real mother. I've loved this baby since long before she ever got pregnant.
All I want is the right to love the person I love and have a family, just like everyone else.
In the world of a lesbian, the basic American rights to life, liberty, and the pursuit of happiness can be challenged at every turn. Discrimination can be found everywhere. Achieving the American dream through events such as buying a home, establishing a career, starting a family, and finding acceptance from those you love can become an obstacle within itself. Women's health is no different. Heterosexism often affects the care a lesbian woman receives during her yearly checkups, prenatal, labor, and postpartum care, and even in carrying out the dying wishes of a lifelong partner dying in the hospital. Lesbian women frequently feel alienated from healthcare services and say their specific needs often go unmet. Despite increasing civil liberties and the recognition of same-sex couples by some individual states, lesbians are advised to create legal documents that identify who they consider their family and can make decisions on their behalf should the need arise. Without such documents to define personal choices, the law will often give preference to legal heirs or relatives in regards to medical decisions and hospital visitation rights. In most states, same-sex partners are not considered legal heirs or relatives. This can create conflicts, especially when family members do not accept the person's partner, and may prevent their involvement in decision-making. The right to conceive is another major legal issue of great concern to many lesbians. For a lesbian couple, having a child is a well-thought-out and deliberately planned process. For lesbian couples, starting a family presents many obstacles. Many of them wrestle with deciding whether or not to use a sperm bank, a known sperm donor, in vitro fertilization, or to forego natural conception and adopt instead. Pros and cons are associated with each, ranging from determining custody to the monetary expenses involved. Health insurance coverage is another factor that lesbian couples desiring a child must consider. Some insurance companies exclude lesbian women from coverage, but are willing to cover the cost of infertility, forcing some lesbian women to either conceal or lie about their status in order to gain health insurance coverage. Others face this hardship by simply paying out-of-pocket for healthcare expenses.
My insurance will pay, which is why I'm the one having the baby. I heard it's best to say you are single, or they might deny you. They cover fertility for single mothers, but not for lesbians, so we lied.
For couples who choose to carry a child, the prenatal, labor, delivery, and postpartum periods are similar to those of a heterosexual couple. During the laboring process, the partner is present, actively coaching the birthing mother. Like heterosexuals, most couples are concerned about their lack of energy and time for their relationship after the birth of the baby. Assistance from the extended family before and after the birth of the baby depends upon individuals' abilities to accept sexual orientation and the creation of a new family dynamic within a homosexual relationship. Lesbian-specific postpartum considerations include the possibility of both mothers breastfeeding through supplemental stimulation of the non-biological mother and societal acceptance of a non-traditional family. Research has shown few differences between heterosexual families and homosexual families as far as repercussions for children. Unfortunately, much of the general public does not support homosexual parenting through beliefs that lesbians are not fit to be parents, are mentally ill, are less maternal than heterosexual women, and have little time for parent-child interactions. Legal issues of custody oftentimes arise for expecting lesbian couples. With both sperm banks and known donors, the mother that did not carry the child must adopt the child in order to be legally considered as a parent. Many states have laws which do not allow for adoption or guardianship by an unmarried partner unless parental rights of the biological parent are terminated. Beyond issues of conception, lesbians face unique challenges within the healthcare system that can cause poor mental and physical health. Many doctors, nurses, and other healthcare providers do not have sufficient training to understand the specific health experiences of lesbians. Attorneys are available and can be consulted to prepare medical consent forms and nomination of guardianship forms in the event of a mother's death or incapacitation, but these forms do not always hold up in court. Several states have passed legislation that will allow co-parents to adopt their partner's children, while other states believe their judicial systems will determine eligibility on a case-by-case basis. There are many possible barriers to optimum health for lesbians. There is often fear of negative reactions from their doctors if they disclose their sexual orientation. Also, doctors may lack an understanding of their disease risks, such as low perceived risk of acquiring sexually transmitted diseases, as well as various types of cancer. Many adolescents, as well as adult lesbians, deal with issues such as increased risk for depression and suicide, a factor that is often overlooked. For these reasons, lesbians often avoid routine health exams and even delay seeking medical care when health problems occur. The nurse plays a critical role in bridging the gap for these women through culturally sensitive care, tolerance, and active listening. Like all women, lesbians are looking for quality care, support, and acceptance, and despite personal beliefs, we as nurses have the responsibility to provide these services.